Hi everyone, today I will go over the health plan benefits for year 2019. If you are shopping for health insurance for year 2019, this presentation will help you see side-by-side comparison of various health plans and possibly help you decide what plan would work best for you and your family. Now, I want to be clear from the start that this is an educational presentation and not a sponsored video. In other words, no one paid me to create it, and I'm not going to market or sell any particular plans here. That being said, I will highly appreciate if you like and share this video and subscribe to this channel. Comments are also always welcome. Now, the information presented here applies for health plans available in California for both private and exchange plan, and this is again for year 2019. Now, remember, if you are getting your health insurance through the exchanges, you can still get tax credits or subsidies as well as enhanced plans for the year 2019. By the way, if you're confused about the ACA law or Affordable Care law changes or have no idea what your options are, feel free to reach out to me directly or comment under this video if this is a general question. I am a licensed insurance agent in California and have contracts with all major carriers in the state, so I have access to the information, rates, and so on, and will be able to help. So let's get started. Now, in terms of the plan design, not much has changed this year. We still have four main categories of health insurance plans, like bronze, silver, gold, and platinum. These categories show how you and your health plan share the costs. Plan categories have nothing to do with the quality of care, by the way. There is also a catastrophic plan for those that qualify, usually for those who are under the age of 30. Each level pays a different portion of your health care bills. Grouping plans this way makes it easier to shop for insurance. For example, the top of the line plan is Platinum. It pays the highest portion of your health care bills. It is also the most expensive one. The basic plan is Bronze. It pays an average of 60% of your healthcare bills and costs the least. You can check out on my website a side-by-side table with all these plans and rates. This is the website. It's insurancecenterhelpline.com. So as I mentioned before, there is a catastrophic plan or minimum coverage plan for those who are under the age of 30. Quite frankly, this plan is a bit tricky, so if you are considering it, I highly advise that you study the benefits carefully before applying for this one. Again, this is an option only for those under the age of 30. Now, there is one very important thing that many consumers do not know and end up overpaying for their health insurance. Those who have minimum coverage plans do not qualify to receive premium assistance, also known as advanced premium tax credit. So be careful with that before you select this plan. Minimum coverage plans usually cover 3 doctor visits or urgent care visits with no out-of-pocket costs and free preventative benefits, and all other services will be full price at the negotiated in-network prices until you reach the out-of-pocket maximum, which is quite high. Now, let's talk about the bronze plans. These are usually the high deductible plans. On average, your health plan pays 60% of your medical expenses and you pay 40%. I will go over the details for this plan shortly. Silver plans are a good alternative for those that can't tolerate a high deductible plan, yet don't want to overpay for a higher level of coverage. As I mentioned in the beginning of this presentation, in some cases, individuals may qualify for an enhanced silver plan. This means that when they choose a silver plan, they have, based on their income, enhanced out-of-pocket savings through lower copays, coinsurance, and deductibles. Individuals in the savings categories get the benefits of a gold or platinum plan for the price of a silver plan. These plans are only available on the exchanges. Feel free to reach out to me and I'll help you understand if you qualify for the enhanced silver plans. Now, gold plans do not have a deductible and the premium is a bit higher. On average, your health plan pays about 80% of your medical expenses and you pay the rest, which is 20%. Platinum plan is the highest level of coverage. It pays an average of 90% of the medical expenses and does not have a deductible. And now let's take a look at a comparison of plans for year 2019. As I said, this is a general plan design, so no matter what health plan you select, Blue Shield, Kaiser, or Oscar, Valley Health Plan, HealthNet, Anthem Blue Cross, Sutter Health, and so on, you will be looking at the same plan structure if you are comparing apples to apples. So here are the medical categories and coverage for year 2019. Now, before I go into the plan details, I wanted to mention that in case of any terminology is unclear, please feel free to watch my videos where I explain what is a deductible, what is a copay, what is a coinsurance, and so on. This will help you navigate the benefit structure of the plans and get an idea of how these plans work. So let's take a closer look at these plans. For bronze plans, you don't pay the deductible for the first 3 visits per year, which includes a combination of primary care, specialist, and urgent care. The lab is $40 and is not subject to deductible. The annual wellness exam, preventative, is included at no extra cost, and the copay for the primary care visit and urgent care is $75 and specialist is $105. This might be a good plan for those that are healthy and rarely go to the doctor. Obviously, if you need more care, you will have to pay more out of your pocket. Again, in the description of this video, I will have a link to a side-by-side comparison of these plans, so feel free to check it out. Now, let's take a look at the silver plan. The silver plan has a lower deductible. There are no restrictions on how many times you can visit the doctor per year. You will pay a deductible mostly when you are hospitalized. Here are the copays for this plan. So basically the deductible is $2,500 per year per person. The primary care visit and urgent care is $40. The lab tests are $35. The gold plan has no deductible. The copays and coinsurance are lower than those for the silver plan. This plan costs more each month, but the insurance pays an average 80% for your medical cost and you pay the rest. Again, there is no deductible. The primary care visit and urgent care are $30 copay. The lab tests are $35. The platinum plan has no deductible. The copays and coinsurance are lower than those for the gold plan. This plan costs more each month, but the insurance company pays an average 90% of your medical costs and you pay the rest. Obviously, the platinum plan has the highest premium each month. If you are healthy and rarely go to the doctor, it might not be a good idea to buy the most expensive plan on the market, right? So here are the copays for this plan. So for the primary care visit, urgent care, and labs, you pay $15. And again, the details are in the description of the video. Now, you can take a look again at a more detailed comparison on my website as well. I can also provide a comparison of rates and plans. So, for example, compare Blue Shield with Kaiser, Oscar, HealthNet, Sutter Health, Anthem Blue Cross, VHP plans, and so on. There is no extra fees for my services, so feel free to take advantage of professional help and advice. Now, I want to mention that dental coverage is not included in the medical plan. So if you need dental insurance, there is a separate plan you can get. The same applies for vision. Only pediatric dental and vision is included in the medical plans at no extra cost. Since dental plans could be a bit tricky, learn your options before buying it. You might also benefit from the negotiated rates for dental and vision plans available through Covered California. Again, I can help with that as well. Now, as you probably know, the penalty for year 2019 was repealed, so it's no longer a requirement to get health insurance for 2019. Honestly, it shouldn't have been a deciding factor whether or not you need health insurance anyways. If you don't have health insurance, you are putting yourself and your family finances at risk. Even nowadays, the main reason people file for bankruptcy is because they did not have health insurance and had to pay for medical bills 100% of the cost out of pocket. Now, even the cheapest bronze plan will pay for your medical bills will pay 60% of the medical expenses and will put an annual cap on how much you pay. So think about it. No one forces you to buy health insurance this year, but no one will pay your medical bills if you have them. So it's up to you. The open enrollment requirement is still enforced. So in California, you can buy health insurance starting from October 15, 2018 through January 15, 2019. Once the open enrollment closes, you no longer can apply for health insurance unless you have a qualifying life event. You can check out our video about the specifics of the qualifying life events on our channel. So that's all for now. If you have questions, feel free to address it in the comments below or reach out directly to us. We love helping people. And of course, if you found this information useful, please share it and like it. We will certainly appreciate it.